wanted to mention we're going to be talking a little bit about the holidays when it comes to your health this week. Uh, Coming up on 8:34. Right now it's 28. We had been at 29. Dr. Jonathan Tripp doing his safety tour through town today.
Right.
Also, you came dressed for the occasion.
I did. I thought, well, this is my last time before Christmas on the radio, so I thought at least I'd wear the Santa Claus hat.
I've got one of
So,
those Santa Claus hats, but it's got a Buffalo Bills logo on it. I'm embarrassed to wear
you don't know. it's
it.
it's in Idaho, it's actually okay to wear almost anything. You're not in a metropolitan area, so you can be fans of almost anywhere, I think.
Yeah.
I ran into a Dallas fan at work 2 days ago, and I said, "You realize I grew up around Philadelphia, their main rival during that time." So, but
Yes, I talked to one of those poor Dallas fans after the Giants lost the other day. He was brokenhearted.
yeah, exactly. Medical school pretty well erased me out of the sports arena, though.
The only thing probably worse is seasonal affective disorder when your team loses.
Yeah, yeah, that's especially in New York from Dallas. Yeah, or whatever. Hey, I have some fun stuff to talk about today, and it really is how to get through the holidays from an acute care point of view. So I called it "How to Get Through Making It Through the Holidays: Acute Illness in Children and in Their Parents." And so I've got some stories to share with you. They're not all holiday related, but they are my children related because we're getting close to the end of this week. We'll have most of the schools out for the entire holiday season. So that Christmas Carol song that talks about and mom and dad can hardly wait for school to start again. That's about to begin. But I have some stories that relate to my kids that I was either at work at my clinic or working in the emergency room when I get a phone call from my wife, and they are the exact kinds of things that can happen to you over this weekend, which I will not wish on anybody. But if your child gets sick, if you get sick, if you get hurt, um, we really will be open every weekday through the season. We'll be down to most days one provider, where we usually have three, so it won't be lots of downtime. But if you're hurt or you're sick, we want to get you in that day or next day and try to get you through your holidays quicker. So, in fact, let me take just a quick minute to. We had a listener who contacted our office and said she was really disappointed because I had said on the radio that we try to get you in the same day or next day. I got to be clear on that. That's if you're hurt, if you're sick. That's where we're trying to keep you from going to the ER, keep you from going to urgent care. And she had tried to get her daughter and family in, and I really don't know the circumstances behind what their appointment purpose was, but they were told they had to wait a week to get in to see me, which I'm the toughest one to get in to see.
Well, then and again, I think we always say generally. I mean, it's not a guarantee. It's
Yeah,
generally.
it is true. It's I would say it's almost our motto. Is our intent is to get you in same day or next day if at all possible, because we want you to come to a place where you feel like you're known and that you belong, even if you've never been there before. So that's I just want to clarify that and actually appreciate the feedback from the listener that that the perception was that we could get anybody in the same day, and that's not really true. But if you're hurt, if you need stitches, you got a sprained ankle, you got strep throat going on, we're going to do our best to get you in today.
Right.
So
Right.
so
Versus just a general checkup, wellness visit.
yeah, yeah. If you're coming in for follow up on my thyroid or my hypertension that you're running out of your medicines, we'll try to help you get the medicines even if we don't see you right away. But that's something that is not urgent. It's more of an urgent need to get to the pharmacy than it is to get health care. So we'll take care of you. We'll get you in as soon as we can, but at the same time, we try to reserve those same day appointments for people that are really needing them. So let me tell you about the baby throwed up. When my two daughters were, very young, the oldest was probably about 3, maybe not even. She's probably 2, 2.5. And the younger sister was about 9 months. We had a little Honda Civic that we had two car seats in the back, and I'm in my internship year, and um, my wife is driving along, and the youngest not only just has spits up, but big time throws up all over the back seat of the car, and my wife is driving, so she can't just stop, turn around, and take care of that. But as she pulls over and tries to start taking care of things, the oldest in her car seat is singing, "The baby throwed up, the baby throwed up." I don't know if there was a Hi Ho the Dario, but it was to that tune. And so that's something that happens with upset tummies, viruses, even food poisoning. Not that I'm saying my 9 month old had food poisoning, but she was sick, and that kind of stuff happens. And then the question is, what do you do other than try to clean the car out? So we'll kind of get to those. My next one is called the heel cutoff. This is not a sports play, but this is my son, my youngest son, at about 3.5, who was riding on the back seat, the back of a longer seat, the old banana seat, something like that, on the older sibling's bike. And we'll get back to that.
Oh, that's right.
We'll hold you in suspense.
Dr. Jonathan Tripp joining us in studio. Better Health with Tripp Family Medicine. We got another 20 minutes to go. Bill Colley with you as well, answering the telephones this morning on News Radio 1310 KLIX, newsradio1310.com. It's 29 at 8:40. Dr. Jonathan Tripp joining us in studio this morning. Better Health with Tripp Family Medicine. Remember, life's too short not to feel good. He's talking about some situations today where people probably didn't feel very good, and how you can work to maybe make them feel a little bit better in his end of the business. And one of those, when as soon as you referenced banana bike, I thought, wow, I haven't seen one of those in years.
Yeah, my kids aren't that old. It was an old bike when we bought it, but it was enough room for the younger child to get on the back and be pedaled around. He was about 3.5, so, and definitely not a child that was to hold back, and still doesn't. Um, so he gets on the bike, and they're riding, dutifully near in our big driveway, and all of a sudden, there's screams, and I'm at work, so I'm hearing this secondhand. But my wife calls up and says that he's cut off the back of his heel and caught his foot in the spokes. And, what do we do? And of course, I'm at the office. And this is kind of one of those situations. If you have a kid with a laceration, or you just call and say, I need to bring this kid in now. And that's exactly what my wife did. The fun part of the story is how we got it done, because this is a 3.5-year-old, and trying to hold them down is no small deal. But we did have to kind of manhandle him to get the the heel numb, and he did tear off almost the entire heel, which was a long healing process with casts and all kinds of stuff. But bottom line is we got by with popsicles, lots of them, and a little portable VCR, TV that we played, I think, a full Disney movie while we took care of his foot. And that later proved to be a technique we used on a lot of kids for lacerations. So popsicles and a Disney video did a lot for helping us get him fixed up. So let me tell you a little bit about throwing up and diarrhea, because we talked about the baby throwed up. Lacerations, parents can pretty well figure those out, that if it cuts all the way through the skin and it's more than really about a half an inch, probably ought to deserve a couple stitches, because kids aren't going to slow down, and that scar is going to remain big even if it doesn't get infected. But and especially if you have something on the face, come see me or a plastic surgeon. My background is about 5 years of purely cosmetic stuff. That does not make me a plastic surgeon. But on the other hand, I'm very concerned about how scars look. So, especially if you got a little kiddo with a laceration of the face, come see me. Let me put that together for you. That's kind of the challenge that I like, to see how good we can make things look. But so, throwing up and diarrhea. Here's the hard part. We were talking off the air about your experience day after Thanksgiving a while back, but is thrown up and diarrhea the same thing? And the answer is usually yes. What is it caused by a virus? Most of the time, yes. Food poisoning? Sometimes. Bacterial or parasites? Rarely in the U.S., but outside of the U.S., it is actually more common than the viral side of that. So we have lots of causes. The number one thing to do is hydration, hydration, and hydration. And did I mention hydration? For whether it's an adult or a child, you're going to be losing volume, and trying to keep that going back in is so key. And sometimes we need an IV, and most offices won't do that. My office will, because a couple of liters of IV fluid and you'll feel, 50, 80% better immediately. That doesn't mean you're cured, but it sure helps you get by and recover more quickly. So, if you got a kiddo that's in trouble, whether it's a fever or whether they're throwing up or diarrhea, the hydration is the number one thing that needs to be done. And if that doesn't seem to be working, especially if a child gets to the point where they're kind of lethargic, laying around, almost like a blob. They need to be seen now, whether it's the office, the emergency room. That's an emergency level. Adults will lay around because they don't feel good, but kids, if they're laying around and you could do things to them that normally would bother them and they just lay there, that's emergency.
I was, when you reference the kids being home and they'll have a week, in some cases, a week and a half,
Uh-huh.
and sometimes these breaks can stretch for 2 weeks depending on where they
Yeah.
fall in the middle of the
Yeah,
week.
we got a full 2+ week one this time.
And that's the thing is they have so many more opportunities because number one, the house is filled with relatives or guests and new toys, and there's a lot of horsing around. So the possibility is much greater for an accident to happen than I guess on any normal period at home.
Yeah, you know, I my family fits right in with all of that. I have children that are active and sometimes careless because they're invincible, and I think most people's children are invincible until they find out they're not. So,
And
so
and that's it's sometimes more than just the little scrapes.
yeah, no, no, I don't need to tell you about other people's experience. I got plenty of my own right at home. So it's as simple as throwing a football and deciding it's worth running to the edge of the rock border and falling over top of that rock border and tearing your knee wide open through your jeans down to the bone. That kind of stuff happens in a heartbeat. Literally, we were just about to get in the car and boom, now we got about a 4-inch scar to create with stitches and whatnot. So, yeah, that happens all the time. But the other thing is, we got lots of people around. Everybody likes to share, whether it's food or colds, and lots of lack of hand washing. So the number one thing I can tell you to do is wash hands a lot, and especially just before you eat or touch your face. Wash your hands because that's what's gonna save you from introducing a lot of illness, whether it's the vomiting and diarrhea or colds, sinus infections, earaches. These are things that, the kids will get into and they'll say, I have an earache. Is that a cold kind of making the ear go bad or is this straight up bacterial? Most of the time, if we have somebody that's over age 12, we consider an earache to be bacterial first. If they're two, we usually consider it to be viral and try to make it through a couple days of pain before we start throwing antibiotics at them. So,
These big family get-togethers too. If you think about it, when we used to pass the dishes around the table,
oh yeah,
one person maybe have something they're not even sure they have virus or
well,
and they're
doesn't show,
passing that dish,
right? Doesn't show up till tomorrow,
and
but
then 15 people end up handling the same dish,
yeah,
and all
and
of a sudden that gets spread.
I'm not saying you can't touch the same serving spoon, but yeah, I would try to avoid sharing cups and the same utensils. If it's been in somebody's mouth, I know they're really cute, but probably ought to get your own utensil. That makes me sound like a germaphobe, but you know, the bigger the crowd, the more likely somebody's got something.
And we used to have at the house during the holidays, Thanksgiving right through Christmas, an enormous wicker dish my mother would have out on the dining table filled with Brazil nuts, walnuts, almonds, and the nutcracker there. And, little kids who were there sometimes are playing with these things.
Exactly.
And so
Yeah,
that
it's not
doesn't
just,
help.
and then funny, it's not just the little kids. I'm not trying to gross people out, but there was a study done on dinner mints at restaurants, that you could pull out with your hand, and the urea content that was in those dinner mints was amazing. And I'll just give you a hint: urea comes from on your hands from not washing your hands in the bathroom. So that's about all I'm going to say on that one. But let me go down to. We talked a little bit about earaches, runny noses. Lots of great things you can do on your own over the counter. Tylenol, ibuprofen for fever or for headache or pain. There's lots of cold remedies. The caution I have is don't buy multiple cold remedies and give them all at the same time. Most of the cautions now say don't give any of them to a child under age 6. I know we can do that at a younger age, but what they're really trying for is some guidance as to what you're giving. So let me give one simple one, and I don't mean to use brand names, but it's an easy one to remember. Dimetap. There's a cold and allergy, which is the most common one they have. It tastes great. It's grape flavored. You don't have to buy the brand name, buy the store brand, but it has an antihistamine and a decongestant. and it says you can use it every 6 hours, so about 4 or 5 times a day, I would caution and say use it half that much. Use it 2 or 3 times a day, and you'll have good success on drying up a nose. You'll have good success on allowing a kid to get a nap or go to sleep. But if you do it every 6 hours, 4 or 5 times a day, you're going to find the kid at the end of the day is just wired for sound because of the decongestant that's in it, and they will be agitated, and so will you. So go low, go slow, low amounts, and if you have questions, call us, come see us. We'd be happy to tell you according to your child's weight how to do that. But that's a simple one. Stick to an antihistamine mostly, and if you need a decongestant, which helps constrict blood vessels so it shrinks tissues, that's great. But when you have 4 or 5 different things in a cold remedy, and then you try to add an antihistamine or decongestant, usually you're doubling up. So that's my caution on those. But if you're struggling with those, come see us. Give us a call. We'll try to get you in like we were talking earlier. Um, Sinus pressure and infection. This is more of an adult understood issue because kids can't really tell you my face hurts or my head hurts. Uh, but you can tell they're congested, so they might have that. If you're a parent, you can push on their cheeks a little bit, right in the front of the cheeks or just above their eyes. If that seems to produce an owie, that probably is a good old sinus pressure. That again, the antihistamine decongestant's a good beginning. Um, Sinus infections, believe it or not, the recommendations by medical authorities are to let them go for a full 10 days to 2 weeks before considering antibiotics. Um, I treat people on a case by case basis, and so sometimes I'll treat sooner than that. But I have great ideas as to how to treat your symptoms and help that. And I have really sharp mid level practitioners that work with me, just phenomenal. Good ER experience, good clinic experience, academically very bright. So, and of course, I've given them a little advice so they know what I would do, but they often have ideas that I look to say, hey, how would I do this a little better? And so we really share the care of a patient between us. We sit so darn close, we can't hardly not share that. So if you're feeling like, well, the doctor never even knows about my condition, you'd be surprised even if I haven't seen you, I probably do know about what's happening there because of the proximity of our work together. So, a couple more stories. Softball bat to the head. Isn't that a great one?
This has happened.
Oh boy, it happens a lot, and it happened in my house. Not actually at the house. My wife was a softball and soccer coach for our kids for 12 years. So the older girls were playing softball. She was their coach, and my son at about age 8, not the same one with the heel, but the other son was, there at practice, and one of the girls from the team decided she, just needed to swing a bat a little bit right then and there, and he was kind of to her left and behind her a little bit, and she did a full swing around and caught him right in the left temple and split his head wide open in about 3 different directions. And that was another one that I got a quick phone call, and I was at the office, and I said, let's put him back together. And my wife's first question wasn't just it's bleeding, but do I need to go to the ER for a CAT scan? And because hit him, knocked him down, and I said, did he cry immediately or did it take him a full 30 seconds to a minute? And that's a long time if you watch it on your watch. And she says, well, no, probably 5 seconds. And he started to cry, and I said, bring him in, he'll be fine. Could I guarantee that? No, but that's a good indicator. Kiddo hits their head. If they cry immediately, they weren't dazed. They're not confused. They just hurt. So he has still a nice little scar there that, you know, actually looks like a miniature star. So, but that it was a lot worse than it ended up. So that's the softball to the head, and then hitting head on the tile. That's another phone call. I was in the ER, and my wife called and said, child fell, hit their head on our tile kitchen floor, and that was my first question again. Did they cry right away? And so my wife, knowing that question from before, said yes, they did, and was annoyed that I wouldn't take more time on the phone because I said at that point, okay, I'll see him when I come home in about 10 hours. So she was, less than impressed with the fatherly attitude, but busy ER, and I just had to make sure she didn't need to bring the kiddo there. So hitting heads, throwing up, runny noses, fevers, earaches. Earaches, by the way, we do have some things that will help with pain, and it's ibuprofen is great, but there's some numbing drops that actually were recently taking off the well, not taken off the market, but just not available in pharmacies anymore. And all it is a numbing drop that I now can get through some of our compounding pharmacies here locally. So that's one of my favorites as a father when you are woken up at 1:30 in the morning and the child is screaming, you can't console them, and you almost can guarantee it's an earache with that kind of a scenario. You give them a dose of ibuprofen, which will take 45 minutes to kick in, but if you get these numbing drops, immediately 5, 10, 15 seconds they have some comfort, and within about 5 minutes they tend to fall back asleep. And before the ear pain kicks in and the numbing drop is gone, the ibuprofen's working, and everybody sleeps for about 6 hours, makes a much better night. So I
we we have to ask you, for people who are listening today.
how do you get a hold of us?
Yeah,
All right. Telephone number. If you're ready with your calling devices, there's
your
many.
stylus.
Yeah, exactly. I can't say pencil. Um, it is area code 208 933 4400. 208 933 4400. You can also reach us on the web at trippvalleymedicine.com and at Facebook at Tripp Valley Medicine. And yes, we'll be trying to take care of you through the holidays.
And I'll talk to you after New Year's.
Fantastic.
And
Merry Christmas,
you
Happy New
too.
Year's, Happy Hanukkah, and Kwanzaa, all the above, anything I can think of.
All right. Got to thank Dr. Jonathan Tripp. Coming up next, following the news at 9 o'clock, Jeanette Rowe will be joining us from the Twin Falls Senior Center. Hope you can stick around. One more hour of Top Story is just ahead. It's 28.